we have an Instagram account, and one of the pinned sayings is, "We need to stop the stigma." I get it. I understand it. I've spoken to people about it. And on this call, I'm still amazed at how radically powerful the stigma is. And what popped into my mind was speaking, I speak to different parents who lost children, and many of them, especially the fathers, will not tell anyone about it.
Yep.
And I was speaking to one yesterday who said that, and again, this might be taken the wrong way, but he said, I think a lot of men feel like their responsibility as fathers is to protect their children. And he said, I just feel like my son had a back injury. He got prescribed morphine or something. He got hooked. You've heard the story 100 times. He got hooked on opioids. It led to other things, and he ended up overdosing the day before he was supposed to go to college. And this is a upper middle class suburban area and socioeconomic status. But he said it's just still the stigma around. His son had diabetes, but it wasn't diabetes, it was a substance use disorder. And yet I wonder, and this isn't exactly anything I planned, but it's interesting how with alcohol, and I know people have written books and given seminars, and this has been talked about ad nauseum, but the stigma with alcohol is nothing close to what the stigma with any kind of, we're talking still about substances that cause addiction, but it's really remarkable how there are plenty of people with alcoholics, I guess, or however you say it these days, but that stigma does not exist in the same way.
No, not only doesn't it exist, but we have a year where we take our kid when they turn 21 for their first drink. Not only does it not exist, the stigma, but we celebrate it. And I'm not a prohibitionist about it, but I think it's something that we need to recognize.
Absolutely. And why would there be a difference? And again, I know you're an expert in this, but why would there be a difference? Because if ultimately we're talking about substances, substance A, B, C, maybe meth is one, and opioids are one, and alcohol is one. If you abstract from the kind, the species is addiction or substance use disorder. And yet that stigma still is so strong. So it sounds like what you're saying then is that we have a long way to go, but thanks to a lot of work from different people in many different fronts, we are as a nation moving in the right direction.
I think we are. And I really applaud those parents who come out, and it's hard, because you feel like you're a bad parent if you lost your kid. Like there's something you did wrong. And I applaud them for talking about it, for, being there, and for others so that they don't go through it.
What has this journey been like for you? It's 2024. Everybody's heard the word fentanyl. I say, if I've learned anything in 7 months of launching this organization, it's that not 9 out of 10, but 19 out of 20 people I speak to do not know what fentanyl is. They've heard the word, and then they just think, oh yeah, cocaine and heroin, and you got to just say no. That's literally what I hear, including from a tenured university professor at the University of California 2 weeks ago. So what's it been like just in this, if you will, journey of fentanyl starting around 2015 until today?
Yeah, I mean, I remember specifically. So we had a little dip in overdose death rates. I think it was 2012, and the USA Today had a front page when they used to have front pages. They had a story about it, and I remember saying, we can't spike the ball because we don't know what's around the corner. And wow. I'll tell you though, that fentanyl wasn't on anybody's radar. We didn't even have a code. So we saw deaths going up, and our data folks were like, well, we think it's this other substance, but we don't have a way to track the deaths because we didn't have the mortality codes for that substance. So then we got the codes and we saw it going up. I'm
going to wonk out a bit, but what does that mean? Like a code?
So it's an ICD-10 code, basically, that identifies what the primary substance is that was involved in the death.
So in computer systems, you got to put in a code.
Yeah, so CDC has the National Center on Vital Statistics, and they do all this. They get the mortality data from the states, and then the feds kind of clean it up, And that's what we get. Now it's reported monthly, but at the time we only got it annually. So it was hard to know what was coming around the corner when you saw the last 12 months. You didn't see, it was not great.
Wow.
So it did show that we had such a criminal justice approach to it that we didn't even have the data that we needed to figure out where the heck we needed to go from a public health perspective. So I do think, I'm not cynical about this. I know that we're in a horrible situation with all these overdose deaths, and it's never fast enough. We are in so much of a better place than we were back then. Everything was criminal justice focused. And as I said, I believe that there's a role for that, but not for the entirety. This is a public health issue. And we need to have the funding. The funding for prevention and treatment has caught up to the funding that we spent on transnational criminal organizations. And we have a lot more engagement with the Centers for Disease Control and Prevention and other HHS agencies. So over time, we had the first drug czar, Michael Botticelli, the first drug czar with a public health background who was in recovery. And we celebrate Recovery Month every month. We are in a much better place than we were back then, 10 years ago.
Can we talk about the difference between, if you're at a party and you're going to drink, you have to have a physical glass and people can see it and it's full of beer or whatever you're drinking. Or if you're, I don't know, smoking marijuana, it seems like this pill culture that we're in is cunning, because someone could be using drugs and have a few pills in his or her pocket, and you would really never know. It's a different kind of, is this making sense? It's a different kind of relationship with the substance in the pill culture that we're in today, which obviously the Mexican cartels are very fond of that reality. Can you speak to that at all?
I think, I think it goes back to that whole awareness about the dangers. And then one of the other harm reduction tools that can be used is fentanyl test strips. Mm-hmm. So you'll know what you're getting.
Yeah.
And so you're not, you'll be aware that if you have this pill, that if you test it, you'll know whether or not it contains fentanyl. I hadn't really thought about how people use it, pills versus it's accessible, and you think that it's safe because it's a pill and it might even have a little emblem on it, might even have a symbol on it that looks like a prescription. And there had been research early on in the overdose epidemic where parents even said, I'd rather have my child take a pill than, a prescribed pill than an illegal substance, because at least they know what they're getting. That has changed over time as people have more awareness of pills. But I think that, certainly it's an easier way to use it. So the barrier to entry would be lower.
Right. I hadn't thought about this really. I don't know if I had much until today, but, I'm thinking of Breaking Bad right now. But for a long time, if you were going to use an illegal narcotic, you were going to have a bong, or you were going to have these meth pipes, or you were going to have a needle, or you were going to have to put some rubber around your arm and find a vein. So there are these, kind of steps or, props that were necessary in order to get your high. And it just seems like a pill seems kind of innocent. I mean, most kids had taken an Advil when they were sick when they were 12, or, and I just wonder sometimes if psychologically a pill seems more benign. We most certainly know that it's not in the case of fentanyl.
Yeah, and when the new initiates, so people who are just starting to use, they're not going to start by using something with, one of the drug paraphernalia pieces you just mentioned.
Paraphernalia, yeah.
They'll start by drinking or with a pill, because it's a lower barrier to entry, and certainly, the traffickers are aware of that.
Well, Regina, I one of our charter is United Against Fentanyl, is a new organization in this space, is to work on what is in the beginning stages of a comprehensive approach. And so for us, we applaud and laud. One of our board members works for a naloxone organization, and that's what they do. And they're getting naloxone into places where it needs to be.
Mm-hmm.
We're we're looking at this as we have foreign policy issues. If the chemicals stopped coming from China, that would help. Even if it was cut in half, it would help. If the cartels, if something was able to happen where they were making and shipping in less, that would help. Border security, especially with legal ports of entry, would help. The dealing issue and finding ways. And then you have the other side of the coin, because that's all supply related, which is what you've done for a very long time, which is trying to find ways to either reduce demand or deal with treatment. And I just want to say that, again, when I get into conversation, I'm offered a choice as, which one are you into? It's a supply problem. No, it's a demand problem. The more I learn about people like you and the work that you've done, and there are many like you, as you know, your colleagues, we need to be very grateful for you and the public service that you have invested in not just our nation, but in thousands or millions of lives. So it's an honor to have you, Regina. I thank you so much for being part of this program.
Thank you very much. Have a great day.
You too.